Today my office released an updated assessment of Ontario's health spending to support members of Parliament, provincial Parliament in evaluating health sector spending in the upcoming 2019 Ontario budget. In this year's report, we found that after 5 years of spending restraint, health sector spending has increased significantly, averaging 4.4% growth each year over the last 2 years, which represents a $12 billion increase in spending by fiscal year 2022-23. Health spending would need to be $8.6 billion below our status quo projection for 2022-23. This represents a health spending reduction of almost 12%. Restraining healthcare spending to this extent without compromising healthcare access or quality would be a significant challenge.
So we could be looking at even bigger frontline healthcare cuts with the proposed legislation. But I can say that without a doubt, the healthcare system cannot withstand a 12% cut or an $8.6 billion cut. I mean, we already have people being cared for in hallways all across this province. There is no way that we can make improvements to the system when sustaining those kinds of cuts. So I'm calling on the government, they need to rethink their tax cut for the 1% that they had in the fall economic statement. And they're going to need to rethink some of their other fiscal plans if they have any hope at all of achieving improvements in healthcare. I mean, you know, the government keeps talking about efficiencies. Well, you know, clearly we need to make sure that efficiencies is not code word for cuts, and the types of cuts that are being suggested in the FAO report are truly alarming, and I think everybody in Ontario recognizes the healthcare system cannot withstand a 12%, $8.6 billion cut. There's just no way.
Do you think they will target it?
I think if indeed that happens, you'll see more people being cared for in hallways. There's no doubt about it. I mean, there's no way the system can withstand that kind of cut. Ontario already has the lowest per capita healthcare spending in the entire country. How can we cut it by an additional 12%? There's no way.
It is impossible to cut $8 billion out of our already stretched healthcare system without having an impact on quality of care, without having an impact on availability of care. The Bill 74 that they have just put in front of the House is not about decreasing overcrowding in our hospital. It is about cutting programs and services to our healthcare system and sending it to the private sector.
And the first priority, of course, is going to be patient safety. That has to overtake all other considerations, but we also know that there are many hospitals that are operating under 100% pressures, and that is one of the reasons why we have hallway healthcare, and we have, I know I've quoted this statistic many times, but I'll do it again. Over 1,000 patients every day in Ontario are being treated in hospital hallways and storage rooms. That is not acceptable.